Hi, I'm Roger Mashad. At Franklin Templeton Investments, we believe that citizens need to be informed about the resources that can help make higher education more affordable. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by New Jersey Council of County Colleges, the Healthcare Foundation of New Jersey, founded by the Jewish community, Johnson & Johnson, Cohn Resnick, Accounting, Tax and Advisory, where forward thinking creates results, Adler Aphasia Center, helping stroke and brain injury survivors recover their speech, the New Jersey Office of the Insurance Fraud Prosecutor. Insurance fraud costs New Jersey families $1,300 a year. And by NJ Best, New Jersey's 529 college savings plan. Turn a dream into a degree. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by NJ Biz, all business, all New Jersey.
Hi, folks. I'm Steve Adubato. Let's talk about where we are with the Affordable Care Act, otherwise known as Obamacare, with someone who deals with it every day. He is Gabe Drapos, who is Chief of Staff, Oscar Health Insurance. We were talking right before we got on the air, and you were saying that as it relates to the Affordable Care Act, Obamacare, some positive signs. What are they?
Sure, yeah. You know, especially in states that chose to go with the federal marketplaces, those states that, you know, in the news in the first years of the Affordable Care Act were the ones that you were hearing about as having slow growth, slow adoption.
Back up for a second. Sorry for interrupting. States had an option.
They did.
A state exchange versus the federal healthcare exchange.
That's right. They could choose to set up their own exchange, which is what states like New York or California did, or they could choose to adopt the federal program.
Which New Jersey did.
That's right.
Go ahead.
And so those states like New Jersey or Texas had slower adoption rates. And, you know, a few years back, there were stories around healthcare.gov not working, things like that. There were also, I think, patterns around the states that chose to adopt the federal exchange and those states that chose not to put as much resources behind Obamacare. So
where are we now? So real progress there?
I think there is progress. So we've seen overall across the country, those states have caught up to the states that chose to start their own marketplaces. For instance, New Jersey, 40% of members that enrolled this third year of the Affordable Care Act were new to the market. And that's a huge increase.
Go back.
Sure. 40%
of those who chose to...
Sure. So 40% of those who enrolled for the first time this year were new to the market. They hadn't enrolled before. So that's a huge increase.
Why do you think that happens?
I think there's a sort of momentum and inertia that needs to be overcome. That, you know, as friends and family start to get insurance, they tell their friends. For instance, with Oscar, 40% of our members come through a friend.
Is that right?
That's right.
Referral. Word of mouth friend.
Yes.
With all the advertising is important, promotion is important. Again, that matters. Word of mouth, key.
Absolutely.
Meaning I had a great experience and someone tells someone.
That's right. Or just the mere fact, hey, look, I can get insured. I can go see a doctor for free for $5, whatever it may be on your specific plan. I have coverage. I know that if something bad is going to happen, I'm going to be protected. That's a powerful message to tell to someone.
The other thing we were talking about, again, which I find fascinating, is the question of public awareness versus confusion about the exchange, about the Affordable Care Act. Where do you think we are there?
I think we still have a ways to go there. Some states, California, for instance, has invested hundreds of millions of dollars a year in this exact thing.
In public education awareness?
Absolutely, just in awareness.
You're saying taxpayer dollars?
Covered California, yes, absolutely.
Go ahead.
And it's still, you know, nationwide, we see that people who were insured for the first time with the Affordable Care Act go to the ER, the emergency room, at a higher rate than anyone else. And things like that, it's because they haven't experienced health insurance. They don't have a history there, having it from an employer or something like that. And so they don't know that they might get hit with a $1,000 bill. And so we need to work on this education. We need to get people better informed about the paths of care that they can take, the costs of that care, and what their plan will cover.
Consumerization of healthcare means?
Sure. I think it means a paradigm shift to health insurers thinking about the consumer first. For 50 years, through just a bizarre history of American tax code, people got health insurance from their employer. And now, for the first time, you have to go directly to a person to get to sell them health insurance. You don't go to an HR benefit specialist. You go to a person, and you have to make a value proposition to them. And by and large, we see people do switch. They are voting with their feet from year to year. This is not a hugely sticky market. In New Jersey, 40% of people, 60% of people who went back to the exchange changed their plans.
They did?
Yes.
From one?
From one to another. Different insurer.
What does that mean to a company like yours?
So I think there's...
Is that opportunity, risk, both? What?
It's both. It's both. Because right now, the sort of inputs to that information to decide where to switch, where to go, are really around premium cost right now, the amount that you pay each month. And so from year to year, you may have people bouncing around for the wrong reasons because while you may go up $5 or $10 compared to your competitor, there are so many other factors that go into this, from the care that the insurer can provide in terms of routing you and being a partner through the system, to the quality of the doctors in the network, everything. It's not just about premium.
So the advice you have for people right now to be their own quote-unquote best advocate is?
They have to be their own best advocate by really doing a bit more research, by not just going to, let's say, healthcare.gov and looking at whatever plan comes up as the cheapest monthly premium, by digging in a little bit. And there are resources out there to help do this, too. New Jersey has the New Jersey Healthcare Quality Institute.
They're great.
They're great. They'll help you.
And they have no, excuse me for interrupting, Gabe. They have no horse in this race.
They don't.
So they provide?
They provide totally unbiased guidance. So do people like Enroll America. I mean, the bias there may be that they want you to get enrolled.
Well, they want people to enroll,
but that's a
but
good
they don't
thing.
tell you where to go.
No. And also localcare.healthcare.gov is a resource where people can go and be connected with a navigator. So somebody who will help them walk through their options. They can set an appointment and really explain everything.
Last question.
Sure.
You told our producers you were thinking that healthcare was, quote, moving in the right direction. Why are you so, I'm not going to say bullish, but positive?
I'm positive because more people are insured. I think while at certain levels in the national discourse, the conversation hasn't progressed, at other levels, people are making moves. People are trying to get to the consumer. All these companies that are trying to work towards making health insurance something that's understandable.
You learned an awful lot about healthcare in the last few years, haven't you?
Absolutely.
It's all good. We're all learning together. Gabe Drapos is Chief of Staff of Oscar Health Insurance. I want to thank you for joining us, Gabe. Appreciate it.
Happy to.
Stay with us. We're right back right after this.
To watch more Caucus New Jersey, find us online and follow us on social media.
Hi, Steve Adubato. I am honored to be joined by Tavis Smiley, the host of the Tavis Smiley Show on PBS, the author of 18 books. You've been talking about and dealing with your Ending Poverty initiative for a long time. What is it? Why is it? And why so committed?
I believe that poverty, Steve, is threatening our very democracy. Let me get even bolder. Poverty is now a matter of national security because these numbers are not sustainable. 1% of the people cannot continue to own and control 40% of the wealth. The 400 wealthiest individuals in this country, 400 people, have wealth equivalent to the bottom 150 million fellow citizens. That's not sustainable. As impolitic as it is to say, that's not a democracy. That's an oligarchy, it's a plutocracy, but it's not a democracy. And so I fret that, again, poverty is destroying our very democracy. It's now a matter of national security. And we have got to talk not just about poverty, but about income inequality, about economic immobility. Thankfully, Bernie Sanders, whatever you thought of Bernie Sanders in this campaign, he put those issues on the table and I think sensitized not only Hillary Clinton, but the rest of us to how important this issue is in this moment.
By the way, one of the many things that Tavis is involved in is a documentary in the fall. In fact, it's on October 7th, looking at the very hotly contested issue, the debated issue of increasing the minimum wage. Now, you've been looking at this.
Sure,
The
fight for 15, yeah.
Fight for 15, $15 minimum wage.
Yeah.
So far, what have you found? Why is it relevant to not just this campaign nationally, but to everyone in this country?
What I found is, and you know this well, I feel like I'm preaching to the choir talking to you because you know this stuff so well, but it's gaining momentum across the country, but state by state, city by city. You've made some progress here in New
Right.
York State.
Right.
We've made progress in LA, certainly Seattle, Oakland, the Bay Area. So there are pockets in the country where this idea is starting to catch hold. But my sense is that the train has left the station. I think you start with a moment. That moment, Steve, builds momentum, and then that momentum turns into a movement. Movements in our country are very rare, as you know. But I think, again, that we've moved past the moment. The momentum is clearly there, and we're now in the early stages of a movement to see the minimum wage increase to a living wage. And even getting up to $15 an hour, by the time these things phase in, most of these cities and states are phasing in over time. It's not happening overnight. By the time we get to 15, we'll still be behind what the minimum wage ought to be when we get there.
So it's interesting. I've been fascinated, and as others who know you across the country, at the things that you have said with respect to and written about President Obama. President Obama on the issue of poverty. I hate when people do a grade because PBS, we're much more thoughtful than that. But I'm going to ask you a grade and a description of it. President Obama on poverty.
Not bold enough. In terms of a grade, I guess I would give him, I don't want to give him a failing grade. I give him a C, C minus.
Well, describe it.
Yeah. And I give him that grade because there are things that he's attempted to do. I mean, I think he'll get great credit in the future. I think the historians are going to be much kinder to him that he's being treated in this present moment. He's going to get a lot of credit for saving this country from a Great Depression when we went through that great recession. He'll get credit for that down the road. But on the issue of poverty, just not bold enough. He did not fight as hard as he should and could have, I think, for a living wage in this country. I think when they passed the stimulus package, which wasn't enough in the first place, they sent the money to the states, not to the cities. If you send it to cities, it gets to the people in urban areas who actually need that kind of support versus Republican governors who send the money and throw it back in your face in some instances, as you well know. So I think there are a number of things that creatively and innovative they could have done to make this fight for 15 much more aggressive.
Those who argue, Tavis, that the Republicans in Congress were never going to give him any leeway and wanted to find a way to beat him at every turn, some say, best you could have hoped for, you say?
They are right about the fact. First of all, they are right that he had obstructionism the kind we've never seen. He had a headwind versus a tailwind. I get that. And yet my grandfather, Steve, said to me all the time, Tavis, there's some fights that ain't worth fighting even if you win, but there are other fights that you have to fight even if you lose. In other words, you have to live your life. You have to govern by a certain set of immutable principles. Campaigning and governing are two very different things. You can promise till the cows come home, but at the end of the day, when you get in to govern, you got to deliver on that. And so all I've tried to do, and some people got it and some people didn't, and I've caught some hell for it. Okay, I'm a big boy, I can handle it. All I've tried to do is to hold him accountable in love, hold him accountable to the things that he said he was going to do. It's troubling for me when so many other constituencies did in fact get something out of the Obama years. Wall Street always gets what it wants. The Jewish lobby got a lot of what it wants. He evolved, to use his word, on the gay and lesbian issues.
How about the poor?
He evolved in that, but not enough. And black people. His most loyal constituency, these are the facts, this is the data, not my data, it's the data. Black people lost ground in every leading economic indicator category over the last decade. Over the last 10 years, black people have lost.
Sorry for interrupting, Tavis. You hold President Obama.
Partially, not completely.
Largely?
I'm not sure I would even say largely. But my point is that black people were his most loyal constituency, and everybody got something but black people. And symbolism is important, but it's not substance. I mean, I'm all for symbolism. I love the fact that my president's black. I voted for this guy twice like everybody else did. That's why I'm holding him accountable. But symbolism alone isn't enough. We need some substance, and the historians are going to have a field day trying to juxtapose the era of the first black president with the bottom falling out for black people.
2016 presidential campaign. What is at stake? Hillary Clinton, Donald Trump. You have called Donald Trump a stone cold racist. Am I wrong?
No. I called him, my direct quote was an irascible, unrepentant, religious, and racial arsonist. And I said that many months ago. I think I turned out to be proven right by the things he has said and done.
Make the case.
To your question about what this election is about, it's about, I think, very simply this, Steve. It's a simple equation. How we get there, I don't know. But this election fundamentally is about what kind of nation we're going to be. That's what it boils down to. The polls indicate that we don't like him or her. We don't like Bill or Hillary. We don't like Donald or Hillary. We don't trust either one of them. But we got to make a choice. And this election is fundamentally about what kind of nation we're going to be. Who are we really as a people? That's what this election, to me, is all about. It's going to make a statement to us. I'll make a statement to the world. It's one thing to profess a set of ideals, I-D-E-A-L-S. But the ideals that we profess as a country, I can't square with the ideas that I hear promulgated in this campaign. So fundamentally, Steve, who are we really as a people? What kind of nation are we really going to be? That is the question I think we have to wrestle with in this particular election cycle.
Tavis, but here's the question I struggle with, and I bet there are a lot of people watching right now on public television as well. Think about it. Donald Trump and what he says and who he is one thing, but the millions who support him, or at least are very uncomfortable with Hillary Clinton, they are another thing. What do you say about them and to them?
That America can do better, number one. It's about appealing to our better angels, not to the lowest common denominator. It is about what happens when you swim in a sea of hate. Even if you're on a racist, when you swim in a sea of hate, you can sometimes get sucked in, pulled in by the current. And again, what kind of nation are we going to be? When Paul Ryan, who I can see being pained by this situation that he has found himself in with Donald Trump as his presumptive nominee, has to make a choice about this. I understand he doesn't like Hillary's, what he would term liberal policies, but do you want a liberal or do you want a racist?
That is the choice in your mind?
I think you look at Donald's racial politics, and it's hard for me to excuse that because you just don't like the other person's politics. Now, that doesn't mean that you, if you're Paul Ryan or some other conservative, that you get out campaigning for Hillary Clinton. But even making that choice makes a statement to me about what you value.
Thank you, Tavis.
Thank you, Steve. Appreciate you, man.
Appreciate you.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
Not only should whites and Jewish people learn up close and personal about the experience of slavery, but those of us who have had that heritage, we need to learn up close and personal the experience that the Jewish people have had.
My father wrote a note to Dr. King. The day we marched together out of Selma was a day of sanctification. There was passion from the prophets, passion from the Bible, from their religious spirit. Even without words, our march was worship. I felt my legs were praying.
We're pleased to welcome our good friend Stephen Ollendorff, founder of the Ollendorff Center for Religious and Human Understanding, and for the first time, Dr. Shari Rogers, who is president and founder of Spill the Honey organization. Welcome, both of you.
Thank you. Thank you.
Stephen's been with us many times talking about a range of important issues. For those who don't know, the Ollendorff Center is?
It's an organization that was initially designed to preserve Judaism primarily initially, and we didn't want Hitler to win the war by indifference or ignorance. But our voyage together has expanded the scope of what we're doing, and we've done very many exciting projects together. And I met Shari because I think we're going to try to address the issue of reparation in the Black and Jewish community.
Yeah. Also, a lot of Stephen's work with the Ollendorff Center talks about the Holocaust and having people understand the extraordinary, unimaginable implications of it. Shari, your organization, Spill the Honey, is?
Spill the Honey, basically the name itself best signifies its mission. It's like the cup runneth over. It's about the sweetness of relation. It's an educational platform to basically educate on the African American Jewish Alliance and the history of the Holocaust and the legacy of Martin Luther King, and how both of those legacies of discrimination and how we worked together during the 1960s during the coalition basically can be taught today to build relationships and tolerance and sweetness.
The Black Jewish Alliance. What is it historically and what is it today? Stephen, go.
It's a very complex issue. Blacks and Jews have had a history taken back from the Exodus, where they both had to leave their countries, prejudice, bias. We know about the Holocaust. We know about what happened to both Jews and blacks, during the 50s. My own personal example was, most of my family died in Germany. My father couldn't get a job at the Eye Institute because he was Jewish. Jewish people couldn't get into certain clubs, couldn't join corporations. So we felt the prejudice, and there was a commonality of interest at that particular point. I think subsequent to that, there's been a certain disengagement, we'll put it this way, I think, on issues where Jewish people instinctively don't like quotas. Because they're used to quotas on the negative end, not on the positive end.
Right.
And there was an instinctive reaction against that.
So that connectedness isn't there the way it was. Where are we today with Black-Jewish relations?
Well, I think we have a lot of work to do in terms of education. How, in particular, the film that I'm working on called Shared Legacies, the African-American...
Shared Legacies. I stepped on that, the African-American.
The African-American Jewish relations. I met Clarence B. Jones, who was Dr. King's personal attorney. And he promised Dr. King, actually in Harlem, he said to Dr. King, he said to Clarence, if the younger generation really does not remember the Jewish support during the civil rights movement, if there's a rise in anti-Semitism, please, Clarence, remind everybody. So I met Clarence Jones at the African American Museum, and so we formed this friendship, and now we're working together on this film about the alliance.
People forget during the civil rights movement, some of who were killed were Jewish.
Absolutely.
And two very famous, well-known cases. Do your research on this, folks. Powerful stuff. Let me ask you this. The connection, how honest is the dialogue with a lot of the strife and a lot of the conflict today? How honest are the differences, at least the perceived differences, between the Black and Jewish community?
That's where I think you need a little bit of political incorrectness, because the Black community and the Jewish community have to realize that bias and prejudice against them will not stick to them. It'll wash over to both sides. In other words, you have to deal with the real issues that are confronting them, how to try to resolve those issues, because they've got to start talking to each other.
Why is it so hard?
Why is the relationship so hard?
Why is it so hard to talk, honestly and candidly?
Well, I think what we learned about the alliance during the 60s is the relationships were real. They were based on real relationships. So the idea is that we have to start working together to form these real alliances that actually can make a difference.
Where is it happening in the country right now? Those real, meaningful conversations between Blacks and Jews?
I think it's basically happening in certain organizations that encourage these alliances. I think definitely, like the NAACP works with different Jewish organizations to build this alliance.
Sure.
But that's why I think it's necessary to create a film to use as a vehicle to spark dialogue.
And that's a big part of the film, is to do that.
Absolutely, to re-educate and see the positive images of what brought us together initially. And through that platform, we can basically spark the dialogue and begin to remember the positive of the working relationships that we need to kind of reinvigorate today.
And your film, The Diary of Anne Frank, talk about the connection.
Well, that's the whole point. In The Diary of Anne Frank, we had Palestinian girls reading from Anne Frank, deciding that what they took from Anne Frank is they wanted education to be free of men, to be independent. And I thought about that a lot. And that's really how we got in touch, because I think if we had the same kind of documentary, which we're discussing, between Black children or leaders discussing Anne Frank's vision and Jewish leaders discussing Martin Luther King's vision, that could start the conversation, because their visions, Anne Frank and Martin Luther King, I think is the winning formula.
It's interesting, you cannot have a meaningful conversation today unless you go back and put that historical relationship in context.
Well, especially when we think about Dr. King, we have to think about how inclusive he was. I mean, he really, in many of the stories of the Jewish biblical stories inspired the civil rights movement, the Exodus story. And he was so about the shared relationships and being inclusive. And I think to bring back his legacy and to remind people of that is really important today.
Finally, before I let you go, Stephen, how hopeful are you that things are going to get better?
I think that what's going on in the world today, responsible people have to revisit these issues, because, especially between blacks and Jews, is that no good will come out of them not cooperating together and seeking common goals.
And that's why we have Stephen Ollendorff and Dr. Shari Rogers with us. The Ollendorff Center for Religious and Human Understanding and Spill the Honey organization. Two powerful films, two great organizations, and two people trying to make a difference. Thank you for joining us on Public Broadcasting.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by New Jersey Council of County Colleges, the Healthcare Foundation of New Jersey, Johnson & Johnson, Cone Resnick, Adler Aphasia Center, the New Jersey Office of the Insurance Fraud Prosecutor, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Hi, I'm Linda Bowden. Aphasia is a language disorder that occurs from a stroke or a brain injury. My dad had a neurological disorder that no one could diagnose. Although his intellect was intact, his speech was getting worse. Then we learned he had aphasia, and we saw firsthand how isolating it can be. It is possible to help those with aphasia improve their communication skills and regain the confidence to live their lives fully. If you or a loved one has been diagnosed with aphasia, there is hope.